Okay guys, it's time to do our second lab. This one's going to be all about anatomical position and languages. Now this actually is going to be on your lab list, unlike the other. So we're going to go through this and I'll check off to make sure that we cover everything on your lab list. What we want to do, you guys may not understand now, some of you may work in healthcare, but we have to be very precise in describing things because we're in a hurry and we've got a huge workload in healthcare and we need to use very few words. Directional terms, this is one of the most important things that we do. We need to be able to explain where something is in as few words as possible. For example, it's not a good hand, wrist, there's the elbow. If someone has a cut right here, I need to be able to describe it so that you don't even have to be in the room. You can visualize it perfectly. And this is where all these directional terms come in. Now, these directional terms are going to be always a comparison, right? I'm going to say something is closer to something else than another thing. So let me just say it like this. If I said Atlanta, or if I said that something is closer to Chattanooga, or Atlanta is closer to Chattanooga, closer than what? It's closer than New York City is to Chattanooga, but it's not as close as maybe some of the smaller towns in North Georgia that are closer. So when we use these terms, we always have to compare it to something else. So if I say my wrist is further away from my body, I've got to say further away than what? It's not as far away from the body as the fingers, but it's further than the elbows. Does that make sense? Hopefully it does. So the example they give is the lateral and medial. If we imagine that there's a middle line that divides our body, these guys in here are saying the ears are lateral to the nose. What are they saying? They're saying that the ears are further from the midline than the nose is. The nose is basically the midline straddles it. Or I could have said the same thing. I could say the ears are lateral to the eyes. The eyes are closer to the midline than the ears. Okay? That's what we're talking about. Now, that's lateral. There's another one that is medial. I've already kind of spoken it. Medial means that something is closer. So lateral means that something is further from the midline. Medial means something is closer to the midline. So let me use my example. The ears are lateral to the eyes. The ears are further from the midline than the eyes. I could also say that differently. I could say the eyes are medial to the ears. So if I'm saying the ears are further away than the eyes, that's the same thing as saying the eyes are closer than the ears. It's just two different ways of saying it. For example, on my little scar right here, on this little cut, I could say this thing is, I could use the elbow or the wrist is where I'm going to be comparing it to. If this thing is closer to the wrist, then I'm probably going to say it's further away from, it's so many centimeters further away than the elbow. If it's closer to the wrist, I'll use the wrist. Okay, we'll talk about some more of these directional terms very shortly, but for right now, let's talk about these regions. There's a lot of them, guys. There is a lot. These are all surface anatomy. This is all about the surface of the skin. If you talk about an area, this isn't referring to what's underneath it. It's just surface anatomy. But it's a way of orienting ourselves. Okay, in the cephalic region, cephalic being head, you've got the forehead, the frontal. The orbital is the eye sockets, the nasal is the nose, oral the mouth. Mental is chin. Let me make sure. Okay. Need to check off all these guys to make sure that we've got everything. Okay, the otic region, that's just another word for ears. Buccal, I don't know if they've got this on here. Well, if they don't, I'll put it there. That is the buccal region, B-U-C-C-A-L. That means your cheeks. That is on your lab list, so it's got to be on there. Cervical region right here refers to the back of the neck, specifically that area where the spinal cord is. Cranial is just another way of referring to the head. So there's another part of the cervical, the neck. Cephalic and cranial are kind of interchangeable, guys. You can use either one of those. And we actually don't have cephalic on the lab list, so, well, we do. It's kind of the overarching region. But cranial is kind of going to be the skull, which for our purposes is basically the whole head. Okay, so let's go to the arm next. It's next on your lab list. The acromial region is this region right here. Antebrachial. Antebrachial is basically the forearm. That's all it is. Antecubital is this area right here. That's the front part where the elbow is crooking, or the crook of the elbow. It's the front portion of the elbow. Axillary is just the armpits right in here. Brachial means the arm. Now I know that when we talk about the arm, we talk about this entire structure here, but actually only this is the arm. That is the antebrachial region, the forearm. So there's the brachial region, it's just the arm. Carpal is your wrist. Let's see where they got it right there. Digital is your fingers, also your toes. They're also considered digital. Manual, as in manual labor, manus, is your hand. Olecranon, what a name. Well, you're going to get used to it, I promise you. Is the back of the elbow, is the olecranon. Palmar, well, that kind of makes sense, I hope. That's your palm. Pollex is your thumb. Scapular region, see if they've got this marked on here. Oh, there it is. Scapula is your shoulder blade. So that kind of makes sense, I hope. All right, that is everything on that. So moving on to the next thing, we have the chest or the thorax. Thoracic region, we have the sternal area. That is your breastbone. That's the common name for that. Mammary region is this region here where the breasts are. Right there. Okay, moving on down into the abdomen or the abdominopelvic region. Okay, we've got the coxal region, which is the hips. Let's see if they have these marked here. Yeah, they do right there. Those are our hip bones right there. That's also the coxal region. Gluteal region is this area right here, guys. Inguinal. The inguinal region is this region. Let me make sure they got it. It's this region right here. It's the region where your legs attach to your torso. Trying to see if they have it on here. Oh, there it is. That's not really the inguinal region. That would be the suprapubic. But in any case, use that for the inguinal region. We'll be consistent. The lumbar region is this region right here. It's on the it's the small of the back is the way it's usually referred to. Perineal region is this region is between the anus and the external genitalia. So if a person was laying like this, and there's the external genitalia of whatever gender, and there's the anus, this would be the perineal region. The pelvic region is this going to be this region right here. It's going to be below. You know what? I need an eraser. I'm going to have to get rid of some of my drawings, guys, so that I can. Well, why aren't you working, eraser? Ah, well. Let's go back. Pelvic, in any case, it's going to be this region. I need to put my drawing back. Sorry, guys. Still getting a little used to this software. In any case, the pelvic region is going to be that region right there. It's going to be underneath the belly button or the umbilicus. So that's got our pelvic. The pubic region is going to be that region that contains the external genitalia, which on my little drawing is right there. And of course on the male, it's going to be right there. Sacral region is going to be this area over here. It's underneath the lumbar. This is going to make a little bit more sense when we get to the bones and we find out that these are basically named for the bones that they are over. The umbilical region is going to be this region right here. It's going to be around the umbilicus. The vertebral region is this region right here, and this is where the spine or the backbone is. Okay, guys, now back to the lower limb, to our leg. We've got the calcaneal region. Let me see if I can find it over here. Calcaneal region is going to be right here. That is your Achilles tendon, if you guys are familiar with that. Just above the foot on the lowest part of the leg. The crural, C-R-U-R-A-L, is everything right there. It's basically the lower leg. And just as we said that this was the arm and this is the forearm, this is the leg and this is the thigh, or this is the crural and this is the femoral region. We'll get to the femoral, well, we'll get to it right now. So the thigh is just called the femoral region. We already said that the toes are also called digital. The big toe has its own special name, just like the thumb does. It's called the hallux. Just to give you a heads up, hallux and pollux are very often confused, so you need to make sure that you keep these guys straight. The front part of the knee is called the patellar region. I'm going to go ahead and jump the list just a few just because it makes sense. The back of the knee, which people will tell you that nobody has a name for, is actually the popliteal region. Pedal, as in pedal, as in gas pedal or bike pedal, is the foot. Plantar is the sole of the foot. The bottom of the foot is the plantar. Sural is going to be just this part, that muscular hump on the very back of your leg, the calf. That's called the sural, S-U-R-A-L. And then the tarsal region is your ankle. That's tarsal. Okay, guys. I know there's more on here that we didn't talk about, but it's not on your lab list. If it's not on your lab list, then it's, oh, occipital is on your lab list. I beg your pardon. Thought that should have been. The occipital region is this area right here. Where the back of your head, it kind of goes under here. That's going to be the occipital region. Now, according to, looks like I've got everything on the surface anatomy. The regional terms have been done, so that is good. Let's go on to the next thing. By the way, these next two slides are purposefully blank. You can print these out and quiz yourself, and I strongly recommend you do so. I've got several of these blank, and all you have to do is quiz yourself, and you can go back to the original and look at it for confirmation. Very good. Okay, now we're going to talk more about those body positions that I said that we were going to cover later, and now it's later. Okay, we have a position called superior and inferior. Superior means that it's toward the top, inferior toward the bottom, but listen to me, they do not apply to the arms and the legs. So I'm saying that these guys are only for your head and your trunk. You do not use superior and inferior on the arms and the legs. We've got something else to talk about that. So please remember that. Superior and inferior should be relatively easy for everybody to remember. It's not that complicated. The thing that trips people up is they forget that it only applies to the torso and the head. Now, we've got two terms, and these are used interchangeably. I didn't mention cranial and caudal. There's a cranial region. Cranial is also superior. But I tell you, just use inferior and superior. Now, on this one, you probably are going to need to know both. There's ventral and there's dorsal. Now, ventral is also anterior. Anterior means toward the front. Dorsal is posterior or toward the back. And again, they're using some examples here. The head is superior to the abdomen. The navel is inferior to the chin, which makes sense. And now on our ventral or anterior, the breastbone is anterior to the spine. Well, the breastbone is right here. The spine is right there. Makes sense. And then for the dorsal or posterior, the heart is posterior to the breastbone. The heart is behind the breastbone. Yep, sure is. Okay, the medial and lateral we've already talked about. Don't worry about this one. We're not going to use intermediate. We've already talked about that. This is just a review for you. Okay, now, what do we do on the arms and the legs since we don't use superior and inferior? I'm glad you asked me that. We use proximal and distal. So how would I say that? What am I saying basically in the proximal and distal? I'm saying something is closer to the torso than something else. Everyone knows that your elbow is closer to your body than the wrist is. The wrist is further away. Proximal just means closer. The elbow is proximal to the wrist. Distal means further away. The knee is distal to the thigh. The knee is further away from the torso than the thigh. Next, we have superficial and deep. Superficial just means it's closer to the surface of the body, and deep means something is deeper than the body. So we can say the skin is superficial to the muscles. Well, sure, the skin is closer to the outside of the body than the muscles. We could also say that the lungs are deep to the skin, or for that matter, we could say the muscles are deep to the skin because they're underneath it. So superficial and deep, that's kind of almost simple or common sense terms. Okay, it's got all of our, oh, no we didn't. Let me tell you, this wasn't on our thing, but it's really simple. Matter of fact, I'll go back again. Ipsilateral and contralateral. Okay, I can say my right arm and my left arm are contralateral. They're on opposite sides of that midline. I could also say that my right arm and my right leg are ipsilateral. This is on your lab list, guys. Ipsilateral, they're on the same side of the midline. That's all it is. Okay, now that does finish that part up. It's got all our regional terms. And I think, what do we got the body cavities next. Yep. Okay. Let's keep moving on, guys. And they've got the body planes, so I guess we'll do the body planes next. Doesn't really make any difference. This stuff doesn't have to be in a certain order. Okay. So if you look on your lab list, it'll call it planes of section. So if you could take a human body and you could imagine a line that divides it in half. Okay, that line divides it into a right half and a left half. That is the sagittal plane. Now, the one that divides it equally into a left and a right half is called the mid-sagittal plane. It can also be called a median, but whatever. I always use mid-sagittal. Is there other sagittal planes? Well, sure. If I had one that divided it, but not into equal left and right, this is obviously unequal right and left. But the big thing about sagittal equals right and left half. This is the way to remember this, guys. Okay, let's talk about the transverse plane. Transverse plane is going to divide us into a superior and inferior half, top and bottom, okay? The coronal plane, well, you could also call that the frontal plane. Matter of fact, I would call it the frontal plane unless you just enjoy using jargon. I'm fine with frontal. The frontal plane is going to divide a body in half, an interior and posterior, front back. That is all there is to the planes. Again, I don't expect you to understand and soak this up in one get-go, but you do have time to invest in this. Okay, there's again a test for you guys. Body cavities. Now we get to the body cavities. So on the body cavities, let's talk about these. We got two main ones, the dorsal and the ventral. The dorsal, we know that means back. The dorsal is going to be the cavity that contains the brain and the spinal cord. Brain and the spinal cord. These things are subdivided. There is a cranial cavity, and the cranial cavity only has the brain. There is a vertebral cavity, and it only contains the spine. How would I ask a question about this on a test? If I ask you which cavity, body cavity, contains the brain and the spinal cord, you say dorsal. If I say which cavity contains only the brain, you say cranial. See, it's not that very difficult. This is also the ventral cavity right here, guys. They're just showing it from the side. Let me do this first, though, and then we can go, because these are divided. So in the ventral cavity, the front cavity, we have the thoracic cavity, which is the chest. That is the diaphragm, the muscle that separates them. And this big space here is the abdomen. This big space right here is the pelvic cavity. Okay, really, there is no dividing line between those. This is below the level of the hip bones, but it's not, there is nothing to, there's no membrane or muscle or anything that closes it off. So oftentimes you hear it referred to as the abdominal pelvic cavity. So that's the way I would probably normally refer to it, but you do need to know that this is divided into an abdominal cavity and a pelvic cavity, but all totaled is the abdominal pelvic cavity. Okay, guys, now we can go, and the thoracic cavity, it's got a lot of divisions. That's because there's a lot of stuff here. There is a lung that sits over here, your right lung, your left lung. There's the heart, and coming up from the heart are those big, huge blood vessels. So the thoracic cavity is divided into a pleural cavity, a right and a left pleural cavity, and each pleural cavity contains a lung. We have a pericardial cavity that contains the heart, and the superior mediastinum contains the big vessels. So that's the thoracic cavity, and of course we talked about the ventral being all of it. And believe it or not, that finishes our body cavities as well. And again, there's one for you to test yourself with. Okay, this is a special surface anatomy that pertains only to the abdomen. This is a 9-region surface, 9 regions of the abdomen. Generally, this is not used actually in the hospital. It's merely used by anatomists, but we have to learn it because it's a school. Okay, if you remember, the umbilical region is right there at the belly button. Now, right here is where the stomach sits. Oops, I got it drawn backwards. Sorry, guys. That area is over the stomach, so it's the epigastric region. Down below that is the hypogastric, which is also the pubic region. I don't know why they say hypogastric there. It makes no sense to me, but it is what it is. Okay, here are the ribs. Ribs, one of the names for ribs is chondro. So this is the right under the rib region, hypochondriac, left hypochondriac. You remember we talked about that section of the back there, the small of the back is the lumbar region. So around that area we call this the right and that the left lumbar. You remember we were talking about this as being the inguinal region. We have a right iliac and a left iliac or inguinal region. So those are the 9 for this guy. There's your practice one. You're required to know the organs that are in each of these regions. So let's go through them. Okay, for the right hypochondriac. Mostly what you're going to see here is going to be the gallbladder and the liver. For the epigastric region, the stomach, there's going to be part of the liver is going to be in there too. There's going to be some part of the gallbladder and some part of the large bowel. On the left hypochondriac region, we've got the diaphragm. Well, that's not really part of it. Forget that. Spleen in the stomach, a small part of the bowels. Okay, for the umbilical region, you're going to have the small intestine and the large intestine. For the right lumbar region, you're going to have the colon, large intestine, and the small bowel, small intestine. For the left lumbar, again, you're going to have the colon and part of the small bowel. For the right iliac region, you're going to have that's really the colon, a special section of the colon known as the cecum, but you also have the appendix. For the left iliac region, you're going to have, there's going to be a small part of the small bowel and the colon. And then for the hypogastric region, you're going to have small bowel, colon, and your urinary bladder. All right, guys, there's yet another one that you guys can practice on. And finally, this is the one that we actually use in the hospital all the time. It's the quadrants. So that's where the belly button would be, right there. You draw two lines. The right upper quadrant, right lower, left upper, left lower. And you just need to know, again, these same organs that were in there before, which really not that big of a deal, seriously. Okay, well, that's got everything for this one. I know it's been a long one, guys, but this is so important, not just for school, but also for what you're going to do when you get out of school. You've got to know this lingo. This is the way we talk at the hospital. All right, guys, I'll see you on the next one.